Good afternoon, guys. A quick little vid after running the dogs. Say hello, Dexter. How do you feel? Do you feel all right? Do you know what? I do actually feel sparkly. How on earth did that catchphrase stick? Anyway, so what's the difference? Was I not feeling sparkly before? I was feeling good. Earning my reward. What was I doing? Breath work, cold therapy, walking the dogs, going to work, ice baths, training, all the stuff that we bang on about all the time. I was practicing what I preached. However, I've got reasonably good genetics. I can get away with a lot. My hormone profile is always pretty much optimal. My lipids, my sugars, all golden. So it means I can get away with bad habits. Drinking at the weekend, not eating super clean, and feeling all right. But you know what? I don't want to feel just all right. So we've been looking at our health. Did the in-body 770 recently. 95 score, not bad. 18% body fat, that's not good. That needs to change. I was a lean, mean fighting machine. I want to get back to where I was and earn my reward. Because it's slightly subdued at the moment. Well, it's not subdued at the moment because I'm doing what I should be doing. But historically, have a drink at the weekend, feel a bit crappy Sunday, bit better Monday, Tuesday, Wednesday, Thursday. Go away, Maddie. But what is that? It's getting through. And if we've spoken about this before, your male androgen levels follow a diurnal pattern. You should do the same thing every day. Go earn your reward. But if you've not got all of your ducks in line, it's difficult to do that. And booze is a problem. Booze disrupts your sleep. Booze causes glutamate to fire really hard after you come off the drink, because you feel good when you're drinking because you've suppressed glutamate. You also, if you're a chronic drinker, cause liver dysregulation and excess aromatization of testosterone to estrogen. And dysregulating that ratio will make you feel anxious and emotional. And we don't want that. Never affected me. My ratio was always perfect. However, I did realize when I had anxiety, it must be estrogen. So I test my levels and it was never estrogen. My levels were always perfect. So it's what I was doing, exposing myself to too much exogenous stress and not dealing with that stress effectively. So I talk about these hormones, I talk about the nervous system and mind from personal experience. I have had the privilege of meeting well over 2,000 of you. They've sat in my chair, they've told me their stories, and I've learnt. And hopefully, I am now imparting the wisdom that I've gained to you guys to make your journey to hormone optimization far more effective and quicker. Because it's not really just hormone optimization that we're seeking, aren't we? We're seeking healthy male androgen levels for long-term physical and psychological well-being. You want to feel good. You want to realize that you need to put all your ducks in line in order to feel good. And how often do you need to do that? Every day. Let me just open the window because Maddie's a little bit panty. So when you realize that, you can't slack. You must realize that everything needs to be in line. And I say this to my patients. Animals, they wake up, they do the same thing every day. They don't have working weeks. They don't have weekends. They don't have vacations. Your physiology, how your body functions, wants you to do the same thing every day. Sorry, I turned the ignition on and the music came on and turned the video off. So, you need to put things in place to allow you to feel good every day. So we've said about this before. One side, catabolic hormones, sympathetic drive. Other side of the seesaw, anabolic hormones and parasympathetic nervous system. Hormones are the foundation. They allow your brain and your nervous system to work effectively for you, not against you. So no, there's no need to be self-destructive. If you think you're getting away with it, you've already had that thought. You're getting away with it. So you're not living to your full potential. And what's the purpose if you're not living to your full potential? David Goggins, big fan. I was glad to see that he takes 20 minutes sometimes to get up there and get out. He looks at his trainers and he says, I've got to do it. I've got to do it. But procrastination, we all procrastinate. But you've got to conquer your inner bitch. You've got to utilize that healthy testosterone. Allow the amygdala, which impacts the decision-making part of your brain, makes you less risk adverse. And when you're young, dumb and full of you do stupid things because we're faced with lots of exciting opportunities to screw ourselves up. And it's only when you get older and you realize you're no longer invincible that you go, shit, okay, I need to do this. So when you make these positive changes, it should have a snowball effect. You are not getting away with it because you've already had that thought in your brain. So you do realize that you're not getting away with it. So ignore that. Get on with it. So, testosterone, I suppose that's what this is about, is merely the foundation for you to go and earn your reward. Get on with the things that you need to get on with. I've invested in a Whoop strap and it's been transformatory. Sometimes I wake up not so sparkly and I look at the strap and go, well, the data, and I go, you did sleep well, stop being a little bitch. And then I have a really good day. Sometimes when I've had a bad night's sleep, yeah, it's all right. You just take it easy today. Don't take it easy. Work on the parasympathetic nervous system, understanding those two arms to the autonomic nervous system. What else? Well, interestingly, my protocol has never changed. It is 12.5 milligrams of test sip daily, 100 IU of HCG daily, and half a tablet of tadalafil, 5 milligrams. More as a preventative thing than anything else. And you know, well, why not? My levels do sometimes fluctuate. When do they fluctuate? When I'm not working properly. And when I'm not working properly and I'm subjected to too much exogenous stress, my levels go up and I feel heightened. My libido drops and I don't want that. So what do? Do you adjust the protocol to compensate? No. You look to address the exogenous stressors that are causing you to be less active and ruminate. That's what you need to do. Don't ask what your TRT protocol can do for you. Ask what you can do for your TRT protocol. And he's going to say it. Go earn your reward.